There's one private question men over 60 ask me more than anything else. Doctor, how many times a week should I be having sex at my age? And is it normal that I can't perform like I used to? I'm Dr. Nancy Ace, your trusted men's health advisor, and today I'm giving you clear, science-backed answers about sex after 60, sexual performance, libido, stamina, and what's actually healthy without shame or judgment. Make sure you watch until the halfway point because I will reveal a completely different way to measure sexual satisfaction that most men never think about. If you're serious about improving your men's health after 60, hit the subscribe button. We're going deep into real solutions.
Before we talk numbers, you need to understand why sex changes with age. This isn't about weakness, it's biology. 1. Testosterone decline. After 50, testosterone levels naturally drop. This affects libido, energy, erection quality. But this doesn't mean desire disappears. It simply becomes less explosive and more subtle. You're not broken, you're aging, and that's normal. 2. Circulation changes. Erections depend heavily on blood flow. If you have high blood pressure, diabetes, high cholesterol, your circulation is slower, which means erections may be weaker or take longer. This is not failure, it's physiology. 3. Medications. Blood pressure meds, diabetes meds, cholesterol drugs, especially beta blockers and diuretics, can affect erections and sexual desire. A simple adjustment by your doctor can improve your sexual performance dramatically. 4. Stress and psychology. Comparing yourself to your younger self creates stress, and stress is one of the fastest ways to kill erections.
What's a normal sex frequency after 60? This is the big question. The truth, there is no universal number. Research shows the average for men over 60 is once or twice per week, but some men thrive with once every 10 days. Others are happy with 2 to 3 times a week. Normal, rarers, whatever feels satisfying and comfortable for you and your partner. Real examples. A 65-year-old patient of mine has sex twice a week and feels great. Another patient the same age, with diabetes and high blood pressure, is happy with once every 2 weeks. Both are normal because both are satisfied. Sexual frequency should match your health, your energy, your relationship, your comfort. No scoreboard. No competition. No comparison. Stop focusing on lasting longer. Most men ask, I only last 3 minutes. Am I failing? Absolutely not. Studies show the average time men over 60 spend in penetration is 3 to 7 minutes. But here's the secret. Penetration is the smallest part of intimacy. What creates real satisfaction is touching, kissing, foreplay, emotional closeness, communication. This usually lasts 15 to 20 minutes and has a bigger impact on pleasure than penetration alone. Measure sex by connection, not by minutes. How to know if you're having too much or too little. You may be doing too much if you feel exhausted, short of breath, tightness or chest pain, muscle fatigue. Listen to your body. You may need more intimacy if your partner feels distant, you're emotionally disconnected. There's tension or lack of closeness. Sex is both physical and emotional. Balance is everything. How to improve sexual health after 61. Walk 30 minutes a day. One of the best natural ways to improve erections, boosts heart health, blood flow, and stamina. 2. Eat foods that boost libido and testosterone. Include salmon, walnuts, almonds, pumpkin seeds, spinach. Foods high in omega-3s and zinc. Healthy heart equals healthy erections. 3. Quit smoking. Smoking narrows arteries and reduces blood flow. Stopping even after 60 improves erections noticeably. 4. Hydrate properly. Dehydration lowers energy and reduces desire.
Mental health and intimacy. Your mindset affects your sexual performance. Don't compare yourself to your younger self. Your body changes, and that's okay. Communicate openly with your partner. Talk about arousal, desire, challenges, preferences. Honesty creates emotional closeness and reduces performance anxiety. Reduce stress. Try deep breathing, meditation, yoga, light stretching. Less stress equals better erections.
Supplements and medications. Helpful supplements. Zinc, vitamin D, magnesium. Medications like Viagra or Cialis work well, but never take them if you're using nitrate-based heart medications. This combination can be dangerous or even deadly. Always talk to your doctor first. Common questions men ask. Does having less sex harm my health? No, but regular sex does help. Immunity, sleep. Heart health. Can too much sex be harmful? Only if you have chronic illness or feel physical strain. Does sex stop at a certain age? No. Plenty of men remain sexually active into their 70s, 80s, even 90s. Habits that damage sexual health. Poor sleep. Aim for 7 to 8 hours. Testosterone is repaired during sleep. 2. Excessive alcohol. It reduces desire, dehydrates you, and weakens erections. 3. Ignoring chronic conditions. Uncontrolled diabetes or blood pressure equals weak blood flow. 4. Isolation and depression. Loneliness drains dopamine and desire. Stay socially connected. Maintain emotional health. Sex after 60 should never be a competition. It's about comfort, connection, pleasure, and emotional closeness. Take care of your health, stay active, communicate openly, and embrace the stage you're in. If you learned something valuable today, hit that subscribe button and comment below with what you plan to improve in your health. Thank you for watching. Take care of yourselves.